Hi, I'm Kathy Zick. I'm with the Armstrong Orthopedic Associates, and I'm here to talk to you about Lovenox, which is a blood thinner that you will start the day after surgery. This is a medicine that you will inject into yourself or from a loved one that is able to do that. You will do it for 10 to 14 days usually, and it's done on a daily basis. You will get a kit that looks like this. And when you open it up, now the medication will not be in here. Your medicine will come from your pharmacy. There is an instruction booklet. There will be a sharps dispenser where you can put, after you've injected, you can put your sharp, the needle in here. Now, before you do your injection, you make sure that you wash your hands with soap and water and that you're clean. Now the Lovenox is to be given in the love handle area on the sides of your abdomen. So I have this little pretend little piece of skin, and what you're going to do is you're going to take out, and they will be in the box, an alcohol swab. And then you want to clean the skin and then throw that away, and you're going to let it dry just a little bit by air. Your Lovenox medication will be in a container that sort of looks like this. And then you will peel it off and you'll take the syringe out. And then there's a top to it. You'll pop that off, and then there's where you expose the needle. You make sure you don't touch the needle. And then you're going to grab skin, and at a 90-degree angle, you will inject the needle into your skin. Once it's in there, then you will push on the plunger, and you will go the whole way down and then directly pull it straight out, and then you're done with the injection. And you want to kind of wipe it with the alcohol once again, and then push the plunger up, and it'll pop the safety device. And then you can put it in the plastic container that comes in this educational box.
Hello, my name is Matt Starr. I'm a nurse practitioner with Dr. Hepner here at Armstrong Orthopedics. Just here to cover some basic things post-operatively with your aftercare for your joint replacement. There's a number of things that we'll be telling you several times, and a lot of times, even though we tell you several times, it's easy to forget. So this is just a reference for you to look back at to cover anything we think may be important. First thing I want to talk about is pain. It doesn't matter what surgery you have, there's always pain after surgery. We've become better at managing pain. We now have a multimodal approach where we use Tylenol around the clock for pain, supplemented by Celebrex unless there are some medical contraindications that you can't take Celebrex. The Celebrex will work for pain and inflammation. And then also some oxycodone. We've tried to limit the narcotic use by patients, cutting back on the opioid use. However, most people still require taking opioids to control their pain. During the surgical procedure, Dr. Hepner will be injecting a cocktail of solutions that also help control your pain. And usually this joint cocktail helps for about 24 to 36 hours to some degree. It won't erase all your pain or prevent all your pain. However, it certainly cuts down on the amount of pain medications that people are now taking. Ice will be supplied. Preferably you'll go to a medical supply store such as Armscare, and you'll have an active ice pack. That ice pack is going to be your best friend for probably the first couple weeks. The ice is going to help, number one, with pain, so use that in addition to taking your pain medications, and also it's going to help with swelling. Number one, at the time of surgery, we will be applying a dressing. It's called a Pico dressing, and what that does is provides a negative pressure and kind of pulls a vacuum to the wound, kind of seals the wound and compresses it so it doesn't bleed, and also provides a good antimicrobial barrier to help prevent post-op infection. That Pico dressing, at the time directly after surgery, all you're going to see is a little tail coming out of your dressing attached to a battery pack. The battery pack is what provides the power to pull suction to the actual negative pressure dressing. That's going to be underneath an ACE wrap, and then directly under the ACE wrap will be some soft roll. It's just a white stuffing type material that's there for padding. We put that on initially for some compression to help the Pico dressing seal and to provide some compression for comfort and keep the swelling down. So that ACE wrap's going to stay on for about 24 hours. So whenever you go home, you'll leave the ACE wrap on the first night. The next day, it doesn't matter what time, sometime in the morning, afternoon, whenever you feel capable of doing it, just simply remove the ACE wrap. There'll be some white stuffing under there. It's called soft roll. You'll remove that as well. Directly under that will be the Pico dressing. It's a little transparent dressing on the sides with a white stripe down the middle. That's connected to that vacuum battery pack, and that'll stay on generally for about 5 days or so. There's a little orange button on the battery pack. That essentially all it does is turn it off and on. Very simple device. There are different flashing lights on the top. When the green light is flashing, that means it's okay and it's doing what it's supposed to be doing. And the next day, if you want to get a shower, if you feel comfortable doing so, go ahead and shower. The Pico, the little vacuum pump, will simply unscrew from the tubing. You'll press the orange button to turn it off, and then you can shower. That dressing is a good waterproof barrier or water resistant. Obviously, you couldn't go swimming with it or submerge it in a bathtub, but if it gets somewhat wet in the shower, it's no big deal. After your shower, you can screw the pump back on, push the orange button to reactivate it. It'll vibrate initially, then the green light will turn on and that will assure you that it's working. Also, you'll notice your knee will have a blue knee immobilizer on it. The knee immobilizer is blue. It has 4 white Velcro straps. That's there to kind of keep your knee straight. That serves 2 purposes. Number 1, it provides some additional stability. Because you've had a nerve block and some injections in and around the joint, sometimes the muscles haven't quite recovered yet over the first 24 hours or so. So that knee immobilizer is there to provide you with some additional stability when you're up and walking on it. So for the first day, maybe even 2, you're going to want to use that blue immobilizer when you're up and walking on it. Also, that blue immobilizer, what it does is kind of keeps your knee in an extended position. We've started using that for during the first couple weeks. When you go to bed at night, you'll want to put that blue immobilizer on just to keep your knee in a straight position. You will also be sent home with a CPM machine. This may already have been delivered to your home, or they may send it home with you from the hospital. The CPM machine you'll use to work on range of motion of the knee. Initially, we'll have you start with the range of motion set from 0 to 80 degrees. Also in the hospital, you'll be instructed on the use of an incentive spirometer. All this is a little breathing or lung exercising device. It's going to help you clear all the air from your lungs so no stagnant air remains. And because if you're not taking deep breaths, you're only taking shallow breaths, little alveoli don't open the whole way. You get some stagnant air in there and even some secretions, which can sometimes cause a fever. So we're going to want you to exercise your lungs afterwards. As an inpatient, we used to use foot pumps or SCDs, which are little sequential compression devices that go on your foot or your ankle or your calf, and all they're doing is promoting circulation. Most likely when you go home, you're not going to use an SCD device. We're just going to recommend you do foot pumping exercises, which is just simply taking your foot and ankle and working on pressing on the gas and then bringing it back as far as you can, working on foot pumping. And again, that's something you'll want to do. You could do that every hour if you'd like, but at least do it every 2 hours, 15 to 20 foot pumping exercises. As far as exercises go, you may feel really good the first evening post-operatively. And anesthesia and those analgesics, they can trick you into thinking that this is a minor procedure. This is still a major procedure. You've had the ends of your bones sawed off, you've had new parts put in there, layers of tissue have been sutured back together, so therefore you're going to want to take it easy and allow this soft tissue to heal before you overdo it. We put knee retractors on each side of the knee. Just simply stretching those collateral ligaments out would be like someone coming in with a strained MCL or LCL, and that takes a couple months to get over. So there are people that think they feel great, right, walking around with no assistive device, no cane, no walker. overdoing it, and then a couple days later they pay for it. They develop a lot of swelling of the leg. That swelling can set back your recovery. That being said, if you overdo it, you get too much swelling, you're not going to be able to bend the knee as well as you would like to. If you're not bending the knee, you'll develop some scar tissue, and then that's going to really set you behind your recovery process. So take it easy on it. Doesn't mean lay on the couch all day, but I would say just a simple guideline: up and on your feet, 20 minutes here, 20 minutes there, and taking it easy and putting some ice on it and resting it. We're also available by phone, 24 hours. So, I mean, you can contact the hospital, dial 543-8500, and they can contact whoever's on call. Most likely it'll be me. If you're having issues with pain or you're noticing something just doesn't seem right, then please call. We like to put out small fires first, not big fires. So any questions, problems, or concerns, please feel free to call.